Starts once people are already infected. So what about disparities leading up to infection? And here this slide shows the diagnostic rates. So the number of new infections per 100,000 people every year. So you can see that for every 100,000 black men, there are 163 new infections, which is twice as high as the rate for white men. And then for every 100,000 black women, there are 56 new infections, which is actually 12 times as high as the rate for white women. So, just building on what Dr. Cespedes said before, there are major disparities evident in new infections. Next slide, please. So one of the things that's been very clear in all of the work on the subject of disparities in new infections is that there are really no major differences in risk behavior. There really are none. One bright spot is actually that if we look at HIV testing in New York City, these are data from the New York City Community Health Survey, which is a telephone survey of about 9,000 New York City adults that's conducted every year. You can actually see that testing is higher among blacks than among other racial ethnic groups. You can see that over 50% of blacks reported that, non-Hispanic blacks reported that they tested in the past year, and that the proportion who had never tested was lowest for blacks, so only 1 in 4 had never tested. So you can see testing is somewhat aligned with the burden of disease, so this is a success. Next slide, please. So I wanted to just talk about the context for HIV prevention and care, and what are some strategies that we can employ here. And I think you'll hear, hopefully, echoes of what others have said already on the panel. So the context for HIV prevention and care is really our national HIV/AIDS strategy, which was released in 2010. And it really is a new era for us in working in public health and medical care, that we have now this vision, this concise plan for moving the country forward. And it sets very specific targets for reducing new infections, increasing access to care, and there's a little animation here, specifically reducing HIV-related, you could just click on that, reducing HIV-related health disparities. So the next slide actually details all of these specific targets that were to reach by 2015, and I just wanted to specifically highlight all of the targets for disparities, so for reducing HIV-related disparities. So for gay and bisexual men, for blacks and for Hispanics, were to increase the proportion with an undetectable viral load by 20% by 2015. So these are some pretty serious targets, very aggressive targets for the country. And the national strategy, was released in 2010. So these are now, 5-year targets, which, all of a sudden 2015 is kind of around the corner. Next slide, please. So how is this translated on the ground? What can we do specifically to address disparities in new infections? And one great way is using policy to promote prevention. And you'll definitely hear echoes of what others have said. If we make the offer of HIV testing routine, then it can be, which is now law in New York State, it's mandatory in clinical settings to offer, not mandatory to test, but mandatory to offer the HIV test. We can ensure that testing is not just for people who specifically request it, and it can remove that stigma of having to ask for a test. We can also use policy to make syringes available for people who inject drugs. And we have a special program in New York State, the Expanded Syringe Access Program. We also know that it's important to address underlying reasons for risk behavior. People are talking about couch surfing, also very important, so instability in housing. Also very important are mental health and substance use problems in risk behavior. So we can promote having co-location of mental health and substance abuse with places where people seek clinical care, such as HIV testing or STD clinics, for example. And we can also support parental acceptance of LGBT youth. There's a lot of research to show that when people are rejected by their families, they have greater risk-taking behavior. And I actually wanted to show you, the next slide shows an example of a campaign supported by the health department by a partner organization in Brooklyn. And this was launched this past fall. And this is an image associated with that campaign to promote parental acceptance of LGBT youth, specifically in communities of color. So next slide, please. So other activities to address disparities in new infections, mobilizing communities for HIV prevention. So this is about forming partnerships, conducting outreach, specifically community level interventions can be very important, and then promoting prevention and care through social marketing and media, and I'll show some examples of this coming up. Not yet. Also, we can improve access to prevention tools and services, distributing condoms, particularly in highly impacted communities, and then also supporting new programs, sexual and behavioral health programs for uninsured populations. And there are actually some organizations represented here tonight are sexual and behavioral health program sites. Those programs are specifically focused on MSM color. And then additionally, supporting increased awareness of and access to PEP and PrEP. These are brand new prevention strategies that use the same antiretroviral medications that have been so successful for care now in a prevention context. Next slide, please. So these are just some examples of the social marketing and media. The campaign on the left was targeted at Black men who have sex with men. It was actually a CDC campaign. There's a little animation here too. So that was launched in February 2012, but it's continued through 2013. And then the campaign on the right is a New York City campaign launched in 2012, run through 2013, targeting Black and Latina women in New York City. Next slide, please. And this is a brand new campaign that was just launched on World AIDS Day this year, targeting men who have sex with men who are HIV positive. So really supporting people to get into care, recognizing that it doesn't have to be hard to take care of HIV, which is obviously something we've just heard a lot about. Okay, next slide, please. So I just wanted to give some examples of just some examples of, I mentioned before, community level interventions. These are special interventions for communities of color around the city, and these use a variety of techniques to really engage communities. And one example are popular opinion leader, also if you're familiar with community promise, it uses role model stories. So really using, promoting HIV prevention behavior by really changing perceived norms and really trying to reach as many people as possible in any given community. Next slide, please. So then the other main strategy, broad strategy, is to address disparities in access to care, access to and quality of care. And this can be done by supporting services and policies to promote early diagnosis and linkage to care, removing barriers to engagement and retention care, increasing access to and quality of care and treatment, and then coordinating care to get the best outcomes. So the next slide actually shows the care continuum, and then this is a slide from my colleague Grant Harriman, who's here, Director of Care Treatment at the Health Department. And on this slide, superimposed, I'm almost done. There's a couple of animations here. You can see different interventions supported by the city that are being conducted at organizations all around the city to support early diagnosis and linkage to care, like outreach in orange, those programs. In yellow, you can see programs that are removing barriers to engagement in care, like mental health, food services, housing, programs that increase access to and quality of care, like ensuring, there's one more thing, ensuring that everyone has access to the drugs that they need, antiretroviral therapy, and then also the case management. So just some examples of really key programs that are helping to support people across the care continuum. So just one more slide here. Just in closing, I wanted to just remind us all that the mission of addressing the care continuum for Blacks in New York City is really central to an overall mission of preventing HIV and caring for all people living with HIV in New York City. Because as you can see from the cascade, what you see here are the darker blue bars are the proportion of African Americans, and then the rest of the bar is all other race ethnicities. And you can see that almost half of each bar is comprised of African Americans. So really preventing HIV in the Black community and caring for Black New Yorkers is completely central to the overall goal of controlling HIV in New York City. So I just in closing wanted to remind us all of the quote from President Obama. This is from World AIDS Day this year, that the U.S. will remain a global leader in the fight against HIV and AIDS. We will stand with you every step of this journey until we reach the day that we know is possible, when all men and women can protect themselves from infection, the day when all people with HIV will have access to the treatments that extend their lives, the day when there are no babies being born with HIV or AIDS, and when we achieve an AIDS-free generation. So thank you again for the opportunity.
So basically what you're looking at right now with this chart is you're going to hear some certain things repeated, but I'm from the school that certain things are worth being repeated. But what is unique to this slide, which is different from other people, is this slide specifically focuses on MSM that are Black, white, and Latino as compared to all persons living with HIV. This slide was specifically given to us from the New York City Department of Health, Ellen as well, so we'd like to thank Ellen. We reached out to her specifically to have information that would supplement our GMHC's forthcoming report, specifically dealing with the disproportionate impact of Black MSM, which will be released soon. And what this is, she provided with us individual cascades for each segment of the population. What this chart is a compilation of all 4 slides put together for you to provide a snapshot. And when you look at this slide, what you will see is Black YMSM, when compared to their racial ethnic MSM peers, have less percentages in every single category. And the causes of this, as explored that is explored in GMHC's forthcoming report, titled "Breaking the Silence: A Call to End Disproportionate Impact Within Black YMSM Community," is the greater health disparity.